101. A patient with type 1 diabetes should check their blood glucose only before meals. True or false? Answer. False rationale. Type 1 diabetes patients often need to check glucose multiple times daily, including before meals, bedtime, and as needed, e.g., during illness or exercise, to maintain control. 102. Hypoglycemia can cause irritability and difficulty concentrating. True or false? Answer. True rationale. Hypoglycemia impairs brain glucose supply, leading to neuroglycopenic symptoms like irritability and poor concentration, requiring prompt carbohydrate administration. 103. Metformin is commonly used to treat diabetic ketoacidosis, DKA. True or false? Answer. False rationale. DKA requires insulin and 4 fluids to correct hyperglycemia and acidosis. Metformin, used for type 2 diabetes, is not indicated for DKA treatment. 104. A blood glucose of 220 mg per deciliter in a type 2 diabetic patient always requires hospitalization. True or false? Answer. False rationale. A glucose of 220 mg per deciliter indicates hyperglycemia but may be managed outpatient with insulin or oral medications, depending on symptoms and patient status. 105. Diabetic patients should avoid cutting their own toenails to prevent injury. True or false? Answer. True rationale. Neuropathy and poor healing increase injury risk when diabetic patients cut toenails, so professional podiatric care is recommended to prevent infections. 106. Insulin glucose has a duration of action up to 24 hours. True or false? Answer. False rationale. Glucose, a rapid-acting insulin, lasts 3 to 5 hours, covering mealtime glucose spikes, unlike long-acting insulins like Glargine, which last up to 24 hours. 107. Hyperglycemic hyperosmolar state, HHS, can cause seizures due to severe dehydration. True or false? Answer. True rationale. HHS causes extreme dehydration, which can lead to electrolyte imbalances and seizures, requiring urgent fluid and insulin therapy. 108. A patient with a blood glucose of 75 mg per deciliter before exercise should delay activity. True or false? Answer. True rationale. A glucose of 75 mg per deciliter is near hypoglycemic levels, and exercise may lower it further, so a snack is needed to raise glucose before activity. 109. Continuous glucose monitors, CGMs, can alert patients to impending hypoglycemia. True or false? Answer. True rationale. CGMs track glucose trends and can alarm for low or falling glucose levels, helping patients act early to prevent hypoglycemia. 110. A diabetic foot ulcer can heal without medical intervention. True or false? Answer. False rationale. Diabetic foot ulcers require professional care, e.g., debridement offloading, due to poor healing and infection risk from neuropathy and hyperglycemia. 111. Type 2 diabetes is caused solely by genetic factors. True or false? Answer. False rationale. Type 2 diabetes results from a combination of genetic predisposition, obesity, and lifestyle factors, not genetics alone, allowing prevention through lifestyle changes. 112. A blood glucose of 350 mg per deciliter in type 1 diabetes requires ketone testing. True or false? Answer. True rationale. Glucose above 250 mg per deciliter in type 1 diabetes may indicate insulin deficiency, and ketone testing detects early DKA risk, guiding urgent treatment. 113. Insulin detamere should be shaken vigorously before injection. True or false? Answer. False rationale. Detamere is a clear insulin that does not require shaking. Vigorous shaking can damage insulin, reducing its effectiveness and affecting glucose control. 114. Hypoglycemia can be prevented by eating meals on a regular schedule. True or false? Answer. True rationale. Regular meals ensure consistent glucose availability, reducing hypoglycemia risk, especially for patients on insulin or sulfonylureas. 115. Patients with diabetes should consume high-fat meals to avoid glucose spikes. True or false? Answer. False rationale. High-fat meals can delay glucose absorption but contribute to insulin resistance and cardiovascular risk, so balanced meals are preferred. 116. Diabetic retinopathy is reversible with laser surgery. True or false? Answer: false rationale. Laser surgery slows diabetic retinopathy progression but cannot reverse existing damage, highlighting the need for early glucose control. 117. A blood glucose of 100 milligrams per deciliter at bedtime requires a snack in all diabetic patients. True or false? Answer: false rationale. A glucose of 100 milligrams per deciliter is normal, and snacks depend on the patient's insulin regimen, activity, and hypoglycemia risk, not a universal need. 118. Insulin aspart can be used to treat hyperglycemic emergencies like DKA. True or false? Answer: false rationale. Regular insulin is used for DKA due to its predictable action. Aspart, a rapid-acting insulin, is for subcutaneous use and not suitable for emergencies. 119. HbA1c levels below 7% indicate good diabetes control for most patients. True or false? Answer: true rationale. An HbA1c below 7% reflects good long-term glucose control, reducing complication risks, though individual targets may vary. 120. A patient with diabetic neuropathy should use cold packs to relieve foot pain. True or false? Answer: false rationale. Cold packs can reduce sensation further in neuropathy, risking injury, and diabetic patients should avoid temperature extremes on their feet. 121. Sulfonylureas like glyburide are safe for patients with sulfa allergies. True or false? Answer: false rationale. Sulfonylureas contain sulfa compounds, and patients with sulfa allergies may have cross-reactivity, requiring alternative medications. 122. A blood glucose of 160 milligrams per deciliter 1 hour after a meal is within target range. True or false? Answer: true rationale. 1 hour postprandial glucose below 180 milligrams per deciliter is generally acceptable for diabetic patients, though targets depend on individual goals. 123. Insulin pumps require daily site changes to prevent infection. True or false? Answer: false rationale. Pump infusion sites are typically changed every 2 to 3 days, not daily, to prevent infection and ensure consistent insulin absorption. 124. Hyperglycemic hyperosmolar state, HHS, has a higher mortality rate than DKA. True or false? Answer: true rationale. HHS has a higher mortality rate, 10 to 20%, than DKA due to severe dehydration, older patient age, and comorbidities, requiring aggressive treatment. 125. Diabetic patients should avoid moisturizing their feet to prevent infections. True or false? Answer: false rationale. Moisturizing prevents skin cracks and infections, but it should be avoided between toes to prevent fungal growth in diabetic patients. 126. A blood glucose of 45 milligrams per deciliter can cause loss of consciousness. True or false? Answer: true rationale. Severe hypoglycemia, below 50 milligrams per deciliter, can impair brain function, leading to unconsciousness if untreated, requiring urgent intervention. 127. Insulin Lispro is a cloudy insulin requiring mixing before use. True or false? Answer: false rationale. Lispro is a clear, rapid-acting insulin that does not require mixing, unlike cloudy insulins like NPH, ensuring proper administration. 128. Diabetic nephropathy increases the risk of cardiovascular disease. True or false? Answer: true rationale. Nephropathy reflects systemic microvascular damage, which also raises cardiovascular risk, a major concern in diabetic patients. 129. A patient with type 1 diabetes can skip basal insulin if fasting. True or false? Answer: false rationale. Basal insulin is essential in type 1 diabetes to prevent hyperglycemia and ketosis, even during fasting, as the body continues glucose production. 130. GLP-1 agonists like dulaglutide can cause weight loss. True or false? Answer: true rationale. GLP-1 One agonists promote satiety and slow gastric emptying, often leading to weight loss, a beneficial effect in type 2 diabetes management. 131. A blood glucose of 280 milligrams per deciliter requires immediate exercise to lower it. True or false? Answer: false rationale. Glucose above 250 milligrams per deciliter may indicate insulin deficiency, and exercise could worsen hyperglycemia or trigger DKA, requiring insulin first. 132. Diabetic patients should have annual dental exams to prevent complications. True or false? Answer: true rationale. Diabetes increases gum disease risk, and annual dental exams detect issues early, preventing infections that could affect glucose control. 133. Regular insulin is the only insulin used in insulin drips. True or false? Answer: true rationale. Regular insulin's predictable kinetics make it the standard for 4 drips in emergencies like DKA, ensuring rapid and controlled glucose reduction. 134. A diabetic foot ulcer should be covered with a tight bandage to promote healing. True or false? Answer: false rationale. Tight bandages can reduce blood flow, worsening diabetic foot ulcers, which require loose, protective dressings and medical care. 135. Hypoglycemia is a common side effect of SGLT2 inhibitors. True or false? Answer: false rationale. SGLT2 inhibitors lower glucose by urinary excretion, rarely causing hypoglycemia unless combined with insulin or sulfonylureas. 136. Diabetic retinopathy can be asymptomatic in its early stages. True or false? Answer: true rationale. Early diabetic retinopathy often has no symptoms, making regular eye exams critical to detect and treat it before vision loss occurs. 137. A blood glucose of 80 milligrams per deciliter before a meal requires carbohydrate intake. True or false? Answer: false rationale. A glucose of 80 milligrams per deciliter is within target range, 80 to 130 mg/dl, for pre-meal levels, requiring no immediate carbohydrates unless other factors apply. 138. Insulin pens should be discarded after one use. True or false? Answer: false rationale. Insulin pens are reusable for multiple doses until empty or expired, e.g., 28 days after opening, with only the needle changed per use. 139. Exercise can cause hyperglycemia in poorly controlled diabetes. True or false? Answer: true rationale. In uncontrolled diabetes, exercise can raise glucose due to stress hormones and glycogenolysis, especially if insulin is insufficient. 140. A patient with type 2 diabetes never requires insulin therapy. True or false? Answer: false rationale. Some type 2 diabetes patients require insulin as beta cell function declines or to achieve control, despite initial non-insulin treatments. 141. Fruity breath is a symptom of hyperglycemia in DKA. True or false? Answer: true rationale. Fruity breath results from acetone, a ketone produced in DKA, a hyperglycemic emergency requiring urgent insulin and fluids. 142. A patient with diabetes should check HbA1c weekly to monitor control. True or false? Answer: false rationale. HbA1c reflects 2 to 3 months of glucose control and is checked every 3 to 6 months, not weekly, unlike daily glucose monitoring. 143. Insulin NPH can be used for mealtime glucose control. True or false? Answer: false rationale. NPH is an intermediate-acting insulin for basal coverage, not suitable for rapid mealtime glucose control, which requires rapid-acting insulins. 144. A blood glucose of 200 milligrams per deciliter at bedtime requires skipping insulin. True or false? Answer: false rationale. A glucose of 200 milligrams per deciliter indicates hyperglycemia, often requiring insulin, e.g., correction dose, to prevent overnight complications, not skipping it. 145. Diabetic neuropathy can cause gastroparesis. True or false? Answer: true rationale. Autonomic neuropathy in diabetes can impair stomach motility, causing gastroparesis, which affects digestion and glucose control. 146. A patient with type 1 diabetes can manage without insulin for short periods. True or false? Answer: false rationale. Type 1 diabetes patients require continuous insulin to prevent rapid hyperglycemia and DKA, as they lack endogenous insulin production. 147. SGLT2 inhibitors can cause dehydration in diabetic patients. True or false? Answer: true rationale. SGLT2 inhibitors increase urinary glucose and water loss, raising dehydration risk, requiring adequate fluid intake and monitoring. 148. A diabetic patient with a blood glucose of 250 milligrams per deciliter should eat candy to stabilize glucose. True or false? Answer: false rationale. Hyperglycemia requires insulin and hydration, not candy, which would worsen glucose levels, risking further complications. 149. Regular insulin can be stored at room temperature for up to 28 days. True or false? Answer: true rationale. Opened regular insulin vials or pens remain stable at room temperature for 28 days, ensuring convenience without compromising potency. 150. Patient education on diabetes includes stress management to improve glucose control. True or false? Answer: true rationale. Stress raises glucose via cortisol and adrenaline, so teaching stress management helps stabilize levels and supports diabetes management.